Hello, everyone. I'm Dr. Angela Mattke, and welcome to Ask the Mayo Mom. I'm a pediatrician at Mayo Clinic Children's Center in Rochester, Minnesota, and host of this show about pediatric health topics. Today, we're talking about vascular malformations and birthmarks. Joining us for this discussion is Dr. Megha Tollefson, a pediatric dermatologist and director of the Vascular Malformations Clinic at Mayo Clinic Children's Center. She's the Associate Dean of Admissions for Mayo Clinic Alex School of Medicine for the Minnesota campus and a Senior Associate Dean at Mayo Clinic Graduate School of Medical Education. Dr. Tollefson is also Professor of Dermatology and Pediatrics at Mayo Clinic, and we are so thrilled to have her join us again today. Remember, if you're listening live, we want to hear from you. So please send in your questions. We'll try to get to them during our live broadcast today. Dr. Tollefson, thanks so much for joining us again.
Yeah, thank you, Dr. Mackey. It's a pleasure being invited to be on the show and to talk about a topic I'm really passionate about.
Yeah, and you really are truly an expert in this area. And there's so many different types of vascular malformations that you do see. Can you start by kind of sharing with us what are some of the things that patients will be referred to see you in your specialty clinic?
Yeah, absolutely. I would love to. It is a complicated topic. The broad topic is vascular birthmarks, and there are so many of them. And so, part of what we try to do is actually just make sense of what a child has. What is this called, and what can I expect? And so, the different types of conditions we see, there's so many, but some of them, might be called hemangiomas. There are more specific names like caposiform hemangioendotheliomas. There are vascular malformations, which are it basically is a term for extra blood vessels. And so there's so many different types of vascular malformations. So capillary malformations, venous malformations, lymphatic malformations, arteriovenous malformation. And there are many children who have a combination of those types. Sometimes vascular malformations are also associated with other conditions in the body. So, one example is one part of the body might be a different size than the other part of the body in a child who also has a vascular malformation or vascular birthmark. Some examples of that is something called Klippel-Trenaunay syndrome or another syndrome called Clove syndrome. So those are the types of conditions that we see fairly regularly in our specialty clinic.
I imagine that a lot of these children are going to present pretty early in life. Is that correct? That you'll see them pretty early in infancy, or do some of these not become apparent until later?
Yeah, it's actually really both. And so
Okay.
there are a good number of children who present with this early in life, especially if their malformation involves visible areas of the body.
Hmm.
There are some people who have malformations and birthmarks that are not in visible parts of the body. And depending on how, what the size of it is, whether or not it's causing any problems, it might not be discovered until later in life, sometimes later in childhood, and actually even rarely in adulthood.
Wow, wow. So because this area is so broad, right? And there's so many different types of malformations and things like that, I imagine that this is a really individualized approach that you need to take with these patients.
Yeah, it is so unique. Every single person, child, adult who has a vascular birthmark is very special and very unique. You can have the same type of malformation in one part of the body in one person, have that same type of malformation in the similar part of the body in another person, and it can act completely differently.
Wow.
So, size, location, age, other health conditions, the impact it's having on a child or a patient, what risks there might be, those are all really important factors to consider. And so, for us especially, we found such great benefit in working together, working together as a team to find what is the right approach for each individual person and family. And so we have to take multiple factors into consideration in deciding, together with the patient and the family, what are the next best steps.
So as you work with the team, again, it's probably individualized and it's a case by case basis, but who are some of the other team members that you would consider consulting with or collaborating with in making these decisions?
Yeah. So that's a great question. Because these are such complicated conditions, one thing I always recommend is really to find care from somebody who's knowledgeable about
Mhm.
these conditions. And it might be, that someone ends up at a clinic where there are multiple physicians working together. That is an ideal situation.
Mm-hmm.
And we're lucky to have that here. Our process actually is fairly rigorous. So it goes through kind of an intake process where every single person who comes to our clinic, their information is evaluated by either me or one of the other physicians that helps to lead this clinic. And so we look at all the available records and imaging, different pictures people have had that are available to us, and we come up with what is the right group of doctors and services? What's the right type of imaging and pictures that we can get to help this child or this person? And so for us, we work with diagnostic radiologists, and those are the doctors that help to look at different scans and interpret these scans. We work with different people that are focused on the medical parts of it. And so me as a pediatric dermatologist, or sometimes the oncologist, the medical oncologist. So, even though these are not cancers, we've learned a lot from principles in treating different cancers that are really applicable to vascular birthmarks. We also work with genetics doctors because the genetics of all of these conditions has become really important over the last 10 years or so. We've learned a lot in that area. And then of course the people that do the procedures. And so interventional radiologists, neurointerventional radiologists, which really focus on the head and neck area, different types of surgeons, surgical specialties, so general surgery, ear, nose, and throat surgery, orthopedic surgery. Those are just a core group of the team that we often work with. And every single patient that we see, we try to identify which of those groups of people are the right groups of people to come together to care for each person.
Okay. That sounds like a lot of kind of work on the front end of seeing these patients, but that is truly, I think, a benefit that you get when you're coming to see a place like someone with, especially when you have so much expertise as you in this area, and you've had a special training in vascular malformations as well. Is that correct?
Yes, absolutely. I think that's another really helpful part is have a physician or group of physicians that has been able to get training in this type of situation. So I was fortunate to get training in a couple of centers who also have specialty clinics. And so I was able to learn the process, learn from the different specialists when I was in residency and fellowship training. And most of the physicians we work with here had a similar experience. So whenever they were going through their residency and fellowship training, they were able to work with others who also had expertise in treating children and people of all ages with vascular birthmarks.
So let's talk a little bit more about what some of the potential treatments that could be utilized for these patients on a case-by-case scenario.
Yeah, there are so many, so many.
Imagine.
So this is where I love our process, where we have physicians from multiple different specialties who do multiple different things come together, talk about each patient in real time together, try to identify what is the right way to go, what are the right steps to take, what are the right treatment options for this specific person in their specific situation. Multiple modalities of treatment. So that's another great thing about this. There's not usually just one answer. And so, it ranges from kind of more conservative type things like compression. So wearing like a stocking to help these blood vessels do the things that they can't do as effectively as you would want them to. There are medical treatments. So things, like aspirin or medicines to help with coagulation, to even some of the more cancer type of medications, even though, again, this is not a cancer, but some of the same principles apply. Other types of treatment are more procedures. And so sometimes we can use laser procedures, especially in the birthmarks that are kind of closer to the surface of the skin and are more visible. Sometimes the interventional radiologist will use a treatment called sclerotherapy. That's one of the more common treatments that we offer. And it's tried and true and has been used for decades, where medicines are injected under ultrasound guidance into these blood vessels to help kind of treat them and shrink them. there's sometimes surgery is used. Surgery is probably used a little less frequently than it used to be, but our surgeons are still a really important part of the care. We go to them to say and ask them to let us know, is surgery a good idea or is maybe not the best idea at the time. I think one really great example of our teams working together is our interventional radiology and surgical teams have worked together to use this kind of newer treatment modality where the interventional radiologist can go and inject some glue into a malformation, then makes the surgery easier for the surgeon to do. So that's a really amazing advancement. There's another type of minimally invasive treatment called MR-guided ablation, which is actually a modality that's been pioneered here to treat vascular malformations. So there's so many options that are available, and not all the options are right in every situation. And oftentimes there is sort of a preference on the part of the team. But again, I can't state enough the importance in that kind of real-time collaboration to think through a process.
Okay, we need to go backwards. I want to hear a little bit more about the glue. Why is that glue helpful? And what kind of glue? Is it just like super glue or some special medical glue that they're putting in there?
It's like super glue, actually.
Okay.
Medical super glue. So
Yes, very high grade. Yes.
Yeah, our interventional radiologist likes to joke about it being Gorilla Glue. But one of the issues with surgery for these vascular birthmarks has been that it's a lot of times hard for the surgeon to go in and really be able to recognize in real time where the malformation goes. Where does it start and where does it stop? And so in the past, a lot of the problems with surgery is that, yes, it would help at the time, but then over time, the malformation will come back. And with glue, that possibility becomes less because the glue travels through the blood vessels, then it stays there. And it really gives this nice defined area for the surgeon to go in and then remove it with surgery. It's not, it's certainly not necessarily indicated or a great option in every person, but in the type of situation where it is, it has been really helpful.
Okay, very cool. I have two other questions about some of the treatments that you mentioned. So why would some patients with certain types of vascular malformations need to be on a medication that would stop clotting? And what kind of medications are you using in those situations?
Yeah, that's a great question. So these vascular birthmarks, especially the ones that are made up of a lot of veins, when blood goes through those veins, it goes through there really slowly because the veins don't have the valves that the normal veins in our body have. And so when blood travels really slowly, it sticks to itself. And that stickiness causes inflammation. And that also leads to changes in coagulation. And so sometimes we have to use medicines that are actually work against coagulation, right? To prevent that stickiness. To help with symptoms and sometimes even with kind of different risks for other types of blood clots that can be very serious. And so some of those medicines, like sometimes it's as simple as an aspirin every day, but sometimes other medications like true anticoagulants are needed. And we really work with our hematology doctors and try and identify, what's the right situation where that's indicated, because of course those also have some risks, and which is the right medicine.
Okay. You mentioned that sometimes you guys use drugs that are also used to treat some types of cancers, which is not the reason why you're using them. What benefits do they give in treating these malformations?
Yeah, so this has really been, I think, life-changing for many people. Now, they're not medicines to take lightly because they have some, serious potential risks. This is where the genetics and the oncology doctors really come together well. This is where that story comes together. So in 15 years, there's been so much great work that's identified that most vascular birthmarks, especially malformations, are caused by differences in gene signature. So that's also sometimes called gene mutations. And so these are genetic conditions, but they're not usually hereditary. So you usually don't inherit them from a parent. You usually don't pass them down. But because there's this genetic basis, there are medicines that we have that work on some of the most common genes that are involved in producing vascular malformations. And those medications are also medications that are used for different cancers who have some similar gene involvement. And so it's really been practice changing. There are two medicines right now that are used probably the most commonly that were really pioneered in cancer care. Um, because in these types of situations, there's really not an end, kind of a defined endpoint like there would be for cancer. It really takes weighing the kind of the right situation, how
Mm-hmm.
much malformation impacting how many problems is it causing, the types of problems, what are the other possible treatments, and is a kind of systemic medicine like this the right thing to do?
I'm glad you said that because that really gets into my next question is, quality of life is so important for all of us. And I think as physicians, we're always trying to strive to make sure that we can do what's appropriate, but also maintain really important quality of life, especially for children, right? That so they can go to school, they can play, they can do these other things and not feel different. So what kind of considerations do you take in those situations?
Yeah, a great question. I think quality of life is something that had kind of been overlooked. I mean, never really truly overlooked, but overlooked
Hmm.
in an area of study. And
Hmm.
so we actually were able to study this over the last few years
Cool.
and found that quality of life of kids and people of all ages who have these vascular birthmarks is significantly impacted.
Mm.
Sometimes even more than chronic conditions like diabetes and cancer and asthma, things like that. So those are the types of conditions where, people with vascular birthmarks and vascular malformations, their quality of life is on par with many of those other conditions. And so, I think we can't underestimate the way that it might impact somebody, whether it's, visible, or it's because of symptoms, or it's because you can't run and play like you'd like to. And so when we're taking care of a child or even adult, that's one of the main things we think about is how is it impacting this person's life and how can we make that impact less? Um, and so that's when we kind of focus on what treatments might help achieve that,
Mhm.
whether it's a procedure or it's a medicine by mouth.
Okay. So that sounds like that's been like a new area of study that your group has been looking into. What else is new in the area of treatment for these patients?
Yeah, some of the things we talked about really are probably the biggest new things. The biggest, advancement is the medical advancement. And so
Hmm.
we talked, I mentioned two medicines, but there are several other medicines that are currently being studied. And the goal is right now, the medicines we have, they kind of act more broadly.
Hmm.
Um, and the goal is with these studies to get medicines that act more and more narrow, and that are really truly focused on each specific type of malformation. That's our ultimate goal.
Hmm.
Um, but the other thing that's new is this MR guided ablation. We've been doing it here now for almost 10 years, and it's just catching on in other places. There are very few centers that do that. And it's a really nice in between for somebody where the sclerotherapy is not an option or it's not helping. And surgery is something I really try to avoid. And we're hoping to not have to use the medicines by mouth. And so in the past, there were really no great options for that type of situation. But this has really kind of changed the treatment prospects for people that used to fall into that group.
And this isn't just in adults. This is being done in pediatric patients as well.
That's right. Yep. All
Awesome.
all ages. All ages.
Wow. Yeah, that's really, really cool. Well, this has been a fantastic discussion. Do you have anything else to add, Dr. Tollefson?
No, I don't think so. I just would say that, if you are a parent of a child who has a vascular birthmark, there are experts out there. There are experts out there that want to help. And really the best situation is a great team that's working together for your child.
Excellent. Thank you so much for joining us again, Dr. Tollefson. And thank you, everyone who listened. Have a wonderful day. Stay safe this summer.